and welcome back to Consider This, Simplifying the COVID Conversation. I'm Heidi Beidinger. So each week I present a mini presentation and we track the COVID-19 data in St. Joseph County together. So let's take a look at this week's data. Let's get started. So if you're new this week, welcome. Each week I present 4 data points, and this is the first one, the average new cases that are occurring in our community. And it's computed on a 7-day rolling average where we take the previous 7 days and total the number of cases on those 7 days, divide by 7, and then we have our average per day. And so we began tracking this data early to mid September, where at that time we were experiencing about 40 new cases per day. And we were seeing a fairly steady increase until early November. And then we saw this very sharp increase occur, going from around 100, 120 new cases per day to going to 310 new cases per day. And then we saw this drop. And this drop, by all accounts, was associated with the holiday, in that there would be reduced testing during the holiday, and subsequently we would see a decrease. And sure enough, yesterday I received the new data, which reported, again, a significant increase over the previous week's worth of data. And we are now averaging 293 new cases per day. So we're virtually at the same point where we were just before Thanksgiving. The second data point are the number of active cases in our community. So we compute this number based on the previous 14 days. We add up the number of active cases from the previous 14 days, divide by 14, and then that gives us the average number of active cases that are in our community. And as you can see from the shape of this graph, you will see that it's very similar to that of the new cases, and that we were at a relatively low number, what we didn't consider a low number at that time, but we do now, at a low point of 538 active cases in our community. We saw this very steady increase. And again, in early November, we saw this very sharp incline. And just days ahead of the Thanksgiving holiday, there were 4,084 active cases on average in our community. And just like with new cases, we saw it drop off a little bit. And now, after having a week pass since the holiday, we're now back up at around nearly 4,000 active cases in our community. The third data point is percent positivity, and this refers to the number of tests that are occurring in our community and the percent that are positive. So again, for all the folks in the denominator, all the folks who are taking the test, and then those who test positive, this is how we derive this statistic. So early in September, we were at 6.4% of all people who were taking the test were testing positive. We saw a little bit of a decrease, and then just like the other graphs, we've seen this pretty steady increase, and then saw that sharp increase in early to mid-November. Here comes Thanksgiving break. We see this little bit of a decrease, and now in the last few days, we've seen an increase again to 11.6%. So again, that means that for all the folks who are taking the COVID test, on average, 11.6% of them are testing positive for COVID. And the fourth data point is R0. This is an estimate, and this reflects community transmission. When you have an R0 that is above 1, that indicates that transmission is active and ongoing in your community. When the R0 is below 1, that means that there is a slowing of community transmission. This chart looks a little different than the other charts, some similarities. You should also know that this is an indication, and R0 is a really complicated statistic, but it is an important one for us to pay attention to. So in the beginning, when we saw this, we actually had a very low transmission rate. And then it was at the end of September that we actually had gone above 1. And we decreased, We've seen this steady increase, and then around Thanksgiving again, we have dipped down, and we are seeing a bit of an increase again. So still below 1, which is supposed to indicate a low transmission, but we are creeping up to that 1. And when you cross over that threshold of 1, that means that active transmission in our community is occurring. And this chart represents how public health experts and epidemiologists interpret the data that I've presented here. So we've talked about the new cases, the active cases, the percent positive from those who are testing for COVID, and then for the community transmission. Again, as public health experts and epidemiologists, we don't take any one metric and make decisions about our community. We take into account all of these things. And then we listen to what our community is saying about what's occurring in our community. And that's how we end up making decisions about what we need to do in terms of where testing sites have to go, if PPE needs to be delivered somewhere, what we're doing about hospitalizations, ICUs, and so forth. As I reported last week, and because we are in the holiday season, I thought it was important to again include what the CDC is recommending in terms of holiday season and gathering. And of course, they are encouraging outdoor activity instead of indoor activity and trying to limit the number of guests to just the local area, that we should not be gathering with folks who are outside of our immediate living area. Limit the number of guests as much as possible, encourage guests to wear masks, and CDC actually released today that they are encouraging mask wearing indoors and to use hand sanitizer. And then finally, ask guests to strictly avoid contact with people outside of their household for 14 days before the gathering. I think the thing that after you read these and digest these recommendations for a moment, you realize that a great deal of planning has to go into our holiday season and our gatherings. So I know that even with my own family, we talk about what's our plan for the holidays. We need to make a plan so that we can adhere to these recommendations. And then I've included some data here from the Kaiser Health Network Foundation that talks about understanding the public health landscape. I thought that these would be really good data points to have in mind as we bring you the 10th week of our webinar series this coming Monday at 6 o'clock. We're going to have Dr. Bob Einters. He's the health officer for our local county health department. And these data points speak to what public health officials are facing at this time. So the Kaiser Foundation in their research has found that since 2010, spending for state and local public health departments has reduced by about 17% per capita, and that local spending actually varies by county and town, even within the same state. And this is certainly true for St. Joseph County. Since 2008, at least 38,000 state and local public health jobs have disappeared. This has left a very thinned workforce. And not only do we not have the manpower, but what has happened is that we are then losing that institutional history, the expertise, and the skills when we lose that kind of workforce. Nearly 2/3 of Americans live in counties that spend more than twice as much on policing as they spend on non-hospital care, which includes public health. And then more than 3/4 of Americans live in states that spend less than $100 per person annually on public health. And it ranges from a low of $32 in Louisiana and $263 in Delaware. Some public health workers earn so little that they qualify for government assistance. At least 70 state and local public health leaders have also announced their resignations, been retired or fired. And this is really particularly concerning. Again, we are losing the leadership that we need, particularly at this time in the pandemic. And then finally, at least 14 states have cut health department budgets or positions or we're actively considering such cuts even in June as the coronavirus cases were surging. So this gives you the landscape for what's happening right now in public health. I encourage you to digest this. The web link is there. And then bring your questions to Monday night when we're having that conversation with our health officer, because we're going to be addressing a lot of these same issues. So as always, this is our email at consider@nd.edu. So again, please send us questions that you might have for Dr. Bob Einters or any part of the this presentation or any other webinars that we have been presenting to you. And of course, here are the websites that I use to gather this data and bring it to you. So I look forward to seeing you on Monday night. Bye-bye.